Hello and welcome to OpenSpecimen webinar series. I am Srikanth Adiga, CEO of OpenSpecimen. In this webinar series, we talk to seasoned OpenSpecimen users about how they use OpenSpecimen in their centers and best practices that they follow. Hope you will find this useful. Thank you.
So, hello everyone, welcome to the webinar. This is a Open Specimen Adoption webinar with the Victorian Cancer Biobank at Melbourne. We have been working with the VCB for the last almost 4+ years, I think so, if I'm not wrong. And Duncan, I'll let you introduce yourself and also a bit about VCB to start with.
Sure. Hi, everyone. My name is Duncan Villanueva. I am the Data Systems Manager here at the Victorian Cancer Biobank, VCB for short. I have recently joined the Central Operations team at the VCB and have been working with OpenSpecimen for 5 months now, although the VCB have been using OpenSpecimen since 2016. Among other things, I am mainly responsible for the management of the data systems, including OpenSpecimen, ensuring best practices, data standards, and compliance. Here at the Central Operations team, we cover project quality and data management, and together we coordinate the 5 tissue bank sites who perform the collections, processing, quality assurance services, and ethics, and to work towards producing biospecimens, data, and other services to support cancer research.
Thanks, Duncan. So let me get started with my questions. So you briefly talked about Victorian Cancer Biobank. What I know is that the way you operate is a bit different than a traditional biobank. So I'd like to know more about the hub and spoke model that you refer to on the website, where as the name stands, Victoria is the state and Melbourne is the city where you're based in, and you collect specimens across the state. So can you give a brief idea about your operations in terms of your specimen collections and how you operate across the state?
So I thought I'd preface that we use OpenSpecimen for our internal use within the consortium. We don't exactly provision access to external groups or users in the traditional sense. In saying that, the VCB consists of 5 major health precincts with a network of 26 hospitals across the public and private sector. And here in our configuration, we use the Victorian Cancer Biobank as the institute and the 5 tissue bank sites as the sites. And OpenSpecimen has the configuration to be able to have a centralized and harmonized platform to be able to coordinate our specimens and data for the researchers.
Right. And when you talk about these 5 precincts, are they all in Melbourne, or some of them are outside Melbourne too?
Sure. So the Victorian Cancer Biobank runs exclusively in the state of Victoria. So these 5 tissue bank sites are within the Victorian state, and then each site has a number of hospitals connected to it.
Right. And do they store? So where are the specimens physically stored? Are they stored in a central repository, or each one of these have their own storage locations?
Yeah, so each tissue bank sites have their own repository for their specimens. We just use OpenSpecimen as a centralized database for security and inventory.
Right. And now coming to the utilization of these specimens, so I assume VCB facilitates through the OpenSpecimen how specimens are distributed, or to whom, how do researchers get access to these specimens?
Sure. They're able to access these specimens via contacting us via email. We also have implemented a online catalog, which I'll touch on a little later, which enables researchers to have a brief overview of our inventory that they may be able to access.
Right, right. Okay, okay. And VCB recently achieved the CTR Net International Biobanking certification. Many of our customers in the US would do CAP certification and maybe ISO certification. So, can you share with us, briefly the process you went through and what is CTR Net to start with? I think it's the Canadian Tissue Repository, maybe certification. So, can you briefly touch upon, what did you do to achieve this certification, as well as how did the process go through? So, how long did it take? What was the efforts on your side and things like that?
Sure. Yeah. Becoming a CTRNet certified biobank last year was an exciting milestone for our consortium. Broadly speaking, the certification required 3 areas of development. Firstly, we completed a comprehensive CTRNet education package, which provided standardized education on biobanking best practices for all VCB personnel. Secondly, we completed a comprehensive quality and documentation review to ensure that we met the CTRNet required operational practices. And thirdly and lastly, as part of the CTRNet review process, each VCB site underwent an external CTRNet audit of several key documents, particularly in the areas of ethics, governance, specimen and data collection, processing, and storage. Regarding the next steps for the VCB, we're committed to maintaining our annual CTRNet certification, and we're currently proactively developing our quality and improvement in line with international biobanking best practices as part of a roadmap towards achieving ISO level accreditation at some point in the future.
So how long did this process take?
Sure. I briefly joined the VCB, so I'm not too sure how long the process took because it occurred before I joined. But yeah, I'm happy to answer that question and check with my quality manager.
Sure. Sounds good. Okay, so with COVID, the last 1.5 years or so has been challenging for everyone. More so from a research point of view, other than the operations being impacted, where your specimen collections, the way you collect, or even going to the labs to collect specimens from the patients, etc., might have got impacted. So, how did COVID impact your operations, as well as are you doing anything that is very specific to COVID?
Not in particular in relation to COVID, but the way that it's impacted the VCB, overall, we've maintained the same project activity, just our consents and our recruitment have been a little hampered. Following the declaration of the pandemic, our sites suspended most biobanking activities, except for clinically rare cases and essential project services, such as clinical trial support. The pandemic resulted in new practices in the hospitals, as you can imagine, including social distancing, telehealth, which made our face-to-face consenting much more difficult. For prospective projects, our site staff collaborate with their pathology department to determine if there's any excess tissue following surgery for our inventory. However, sometimes there were a temporary restriction from the pathology department as they were enduring their own COVID impacts themselves. It affected the number of surgeries performed. In some periods, surgeries were non-essential and not suitable for our biobank, such as knee reconstructions. During some periods, our site staff had to work from home during essential and more relevant surgeries as well, so we missed out on those collections. But in saying this, there's still a high demand of project inquiries.
Sure. So now let's go back a bit to your OpenSpecimen. One of the things that would be a lot of interest to the community is how you manage OpenSpecimen. in terms of how do you train users. You have 5 sites where each one of those sites are physically in separate locations, or maybe even distant locations. So, and each one of them have their own users. So now let's go through things like, how do you train a new user? So is it done centrally by the VCB, or each sites take care of doing the training internally? And what kind of staff support do you have within internal, in terms of, say, the number of resources who are dedicated to OpenSpecimen, etc.?
Sure. Again, I'd probably preface that we use OpenSpecimen for our internal use within the consortium. Don't really provision access to external users in the traditional sense. But when we do receive a project, it's my job to create a new collection protocol. All the details are required to create the collection protocol is available through our application process. For example, the time points, specimen types, number of specimens obtained, expected. And creating this collection protocol is a fairly straightforward process with OpenSpecimen. In terms of training our new users, we have developed a training program to run them through. Before starting OpenSpecimen training, we provide core operational documents, CTRnet biobanking education modules, an overview of our operations and governance. We then provide a OpenSpecimen presentation along with standard operating procedures, a data dictionary, a OpenSpecimen manual that we've created for them to read beforehand. I give them a demonstration on our test environment, imitating business functions before letting them access our production environment. They then undergo continuous training, shadowing their fellow site staff. We also provide them the helpful link to the OpenSpecimen wiki, where they can find additional learning material. In terms of the number of FTEs that work on OpenSpecimen, that would purely just be me with some assistance from my team. But generally speaking, I manage and maintain the OpenSpecimen database for VCB.
Sure. And are you, and do you do only OpenSpecimen, or part of your time is spent on OpenSpecimen?
Most of my time is spent on OpenSpecimen. Not that there's a lot of maintenance to do, but just continuous improvement in terms of our efficiencies for our business operations, really.
Sure. And the second thing is, how do you release new versions to your, when you do an upgrade? How do you retrain your users, or is there a process that you follow, like you do an upgrade every year? I know you have been here for 5 months, but do you follow a fixed pattern?
Yeah. So regarding the release of new versions, we had a major upgrade recently, and plan to perform one each year. Generally speaking, we would work closely with the vendor team, implementing and testing the upgrade of our test environment. And then we perform user acceptance tests before replicating this onto our production environment.
Okay. And there are a few questions trickling in chat, so let me take that. So about reporting, what kind of reports do you generate from OpenSpecimen, and who are the consumers? Like, do you generate a management report versus internal operations report, audit report? What kind of reporting do you do within OpenSpecimen?
So we use the querying functionality quite extensively here at the VCB. We use it for obviously specimen availability, business analytics, and auditing purposes. In terms of the types of reports that we use, we extract data regarding consent, collections, dispatch, and inventory on a regular basis. And we were able to make comparisons like year on year, determine trends, and we prepare this data for our annual business report for our external stakeholders as well.
Sure. Sure. And as far as analytics, and is there a external data warehouse where you also push data, and or do you just extract data and do things in Excel sheets?
At this stage, we extract a lot of data from OpenSpecimen and manipulate it in Excel for our purposes on a more granular level.
Sure, sure. And one of the other, sorry, I hear sorry. So one of the other question that's coming up is with integration with other systems. I don't think, from what I know, you guys have done any integration, but is there any plans?
But yeah, no integration with clinical healthcare systems at this stage. We do capture clinical data via electronic medical records on a manual basis through our site staff, and also other registries such as the Victorian Cancer Registry. But yeah, no integration at the moment. In terms of future plans, I think everyone would like to achieve integration with hospital systems, but I think that's a work in progress, definitely.
Sure. So when you have these 5 hospitals, do all of them have different systems, or do they all use a central EMR or clinical system?
Yeah, I believe each hospital has various systems. Some overlap, some don't, but neither are connected to each other really.
Right.
But in saying that, yeah, we would like to
That
achieve integration with all of them.
right. That makes it more challenging, I guess.
It definitely does.
So now, and you talked about clinical data from these systems. Then do you manually export and import them into OpenSpecimen, or do you just keep it outside and somehow manage to merge all the data?
So at this stage, we manually enter the clinical data. For instance, for pathology, clinical history. But yeah, we do have plans to be able to bulk import such data, which OpenSpecimen allows us to do. Yeah, which we're currently working
Sure,
towards.
sure. So, for the interest of others, where I see quite a few integration questions. So, integration can be achieved even though VCB is not using it with applications like EMR, HL7, RedCap, OpenClinica, etc. With either through APIs, or we have ready-made plugins for doing that. So, we won't be talking about that in detail here. The documentation is available on our wiki, or feel free to email me and I'll point you to the right places. So Courtney is asking, interested to know how this software is utilized in your lab day to day. Do you have staff entering direct to OpenSpecimen, or still use intermediate recording method? So I assume this, so everyone as far as entering data into OpenSpecimen is concerned, you're directly entering into OpenSpecimen and not through, so there's no intermediate recording methods, right?
No intermediate. Our site staff directly enter the data, the clinical data, the consents, specimen data, the inventory, directly into OpenSpecimen.
Sure. And you briefly touched about generating consent reports from OpenSpecimen. So can you explain this process a bit? So how is the consent data entered, and also how is the consent data collected from the patient? Is it through your EMR, or someone is actually doing it on pen and paper, and then you are entering it in OpenSpecimen?
Sure. So our site staff obtain written consent from patients during patient visits or prior to surgeries. They then, once they've obtained the written consent, they enter this data they register the patient into OpenSpecimen, capturing the consent, uh, you know, the number of questions. And while OpenSpecimen provides a consent module, we've created our own customized form for our consents.
And how do you handle things like, say, reconsenting, or someone withdrawing a consent and things like that?
Sure. Yeah. When that occasion when that occasion occurs, which is rare, but it does happen. OpenSpecimen has that feature to anonymize, which is what we use, which de-identifies the whole patient and just leaves I think the master patient identifier, and we use that we obviously have internal records of withdrawn consents, but in terms of OpenSpecimen, yeah, we use the anonymized feature on OpenSpecimen to de-identify the patient, the donor.
Right. Okay. That kind of answers one of the next questions you had. So for the questions on the chat, we'll come back to any unanswered questions and also open the forum for directly ask questions to Duncan at the end. So if some questions are not answered, you'll be we'll have time at the end to come back to it. I had one last question. So a few days back, Victorian Cancer Biobank conducted a virtual forum of biobanking. I think it was just a couple of days back.
A few days ago.
Yeah. So how did it go? What were the highlights of the session, and anything that the community should know?
Sure. Yeah, the forum was great. It went well. We got to hear perspectives from experts about how they have seen the industry evolve, new opportunities and paths for career development within biobanking. What really interested me was the various educational opportunities currently available, ranging from online webinars, online short courses, and even face-to-face university degrees. In particular, I think there was a master's degree on biobanks and complex data management available in France, which would have been good to have back in the day.
Okay. And one last question. I know you like hiking and maybe going on trek. So what's your favorite hiking spot in Melbourne or Victorian?
To be frank, I've just recently moved to Melbourne, so I haven't had a chance to experience the outdoors just yet. Funnily enough, ever since I've joined the VCB, I've been working in a virtual capacity and haven't been to the office, which is interesting. Hopefully
Okay.
soon.
So where were you before Victorian Cancer Biobank?
Sure. Yeah, I was based in Sydney, in the state of New South Wales, just above.
Right. Okay. So with that, we'll end this Q&A session. And Duncan, I suppose you are already a presenter, or else I'll make you the presenter once again. You can take over and do your webinar talk, and then we'll come back and take the questions as they happen.